In the second part of this lecture, we'll talk about anti-clotting system as well as some disorders related to hemostasis. But before that, let me summarize on blood clotting with two important points. Number one, when you have a cut externally, that exposes the tissue factor that initially triggers only the extrinsic pathway, leading to thrombin production. But the amount of thrombin produced are too small for sustained coagulation. But also don't forget that thrombin itself is the positive feedback activator that can activate the intrinsic pathway. In other words, both pathways are normally operating in clot formation because the activation of the extrinsic pathway can subsequently also activate the intrinsic pathway. Okay, coagulation or blood clotting is vital but could also potentially lethal because when it is uncontrolled, it can block our blood vessels, making the tissues in the downstream deprived of both oxygen and also nutrients. So we do not want this to happen in normal situation. And therefore, we have two control systems in place to inhibit coagulation. So the first control system or the first anti-clotting system is known as the anti-thrombin system. So it is basically an inhibitor to clotting factors, especially thrombin. So the activity of this anti-thrombin is enhanced by heparin, which is normally present on the endothelial cells. So if someone has antithrombin deficiency due to genetic mutation, that person might suffer from venous thrombosis, which means the blockade of your veins, or pulmonary embolism, which is the blockade of the arteries in the lungs. The second anti-clotting system we have is comprised of three protein units, which are thrombomodulin, protein C, and protein S. So the endothelial cells can express thrombomodulin, which will bind to thrombin with two effects. Number one, such binding inactivates thrombin, and therefore there will be no coagulation. While number two, thrombomodulin can also activate protein C. So what is protein C? Protein C is basically an inhibitor for the blood clotting factors number 5 and number 8. But for protein C to function, it will require a cofactor, and that cofactor is protein S. So in addition to these control measures that prevent blood clotting, there is another mechanism, which is fibrinolysis, that will break down the fibrin clot completely. We know that blood clot is not a permanent solution to injury because what we want is recovery. In fact, the aggregated platelets secrete a factor known as the PDGF-beta that recruits fibroblasts from the surrounding tissue, and fibroblasts will form the scar tissue around the site of injury. And at the same time, the blood clot is dissolved by a fibrinolytic enzyme known as plasmin. Because if these clots are not removed, they may eventually block the blood vessels, leading to thromboembolism or the blockade of blood vessels. As I mentioned, a blood clot is broken down by the enzyme plasmin. And for plasmin to function, we will need tissue plasminogen activator or TPA because it is an activator for the enzyme plasmin. And TPA is secreted by the endothelial cells. But for TPA to function, it will first have to bind to fibrin before they can be activated themselves. And therefore, it's only possible for TPA to work on the clot. So here is a summary of the process. To convert plasminogen into plasmin, we will need the activator TPA that's secreted by the endothelial cells. And for TPA to be active, it will also have to bind onto fibrin. So with the activated plasmin enzyme, we can then break down the insoluble fibrin into the soluble fibrin fragments. So clinically, the discovery of TPA is very important because we can now use TPA to treat patients with blood clots, such as in the case of heart attack. But of course, the golden standard today is still to remove blood clots by surgery. But TPA does offer a non-invasive treatment. Okay, there you have a nasty bruise or a contusion. So a bruise or a contusion is caused by internal bleeding, and your body has the mechanism to remove that blood clot. So it all begins with hemoglobin, which is reddish in color. and then very slowly it will be degraded and converted into biliverdin that's greenish in color, and it will be then converted into bilirubin and hemosiderin that is yellowish in color. And eventually these blood clots will be removed by plasmin action and from the help of the phagocytic cells. So you can actually time your bruise by looking at its color. So the latest bruise will be red or bluish in color because of this hemoglobin, while the oldest wound will look like yellowish due to the presence of this bilirubin. But occasionally, blood clot can form inside your blood vessels. When the blood clot is attached to the blood vessel, it is known as a thrombus. When it is free floating, it is called the embolus in the singular form or emboli in the plural form. So there could be several factors that may cause these clots to happen. Number one, it tends to happen when you have a roughened vessel surfaces or arteriosclerosis, which is caused by the deposits of cholesterol. And sometimes you could have imbalances in your blood clotting factors. For example, if several factors is missing due to mutation. Or number three, when you have a slow moving blood, such as in the case of varicose veins. So that could lead to thromboembolism. And last but not least, you could have widespread clotting. Sometimes if you are having a traumatized tissue that release thromboplastin in the large quantity. So that will trigger widespread clotting around the body. So when a thrombus blocks more than 3/4 or 75% of the arteries, it can lead to hypoxia or the lack of oxygen, and also the accumulation of some waste products such as lactic acid. But when it's more than 90%, it can lead to anoxia and infarction, which means cell death. So the coronary artery disease is one good example of the thromboembolism because it's caused by the narrowing of your arteries due to the accumulation and the deposits of cholesterol. So with that, you can imagine how easy that a blood clot can be formed over here and shut off oxygen supply to your cardiac tissues. And showing here is a list of inherited disorders of hemostasis. And when I say disorders of hemostasis, it has dual meaning. Number one, it could be problems with triggering blood clotting from happening, or number two, problem with inhibiting blood clotting from happening. So number one, it might be present in the form of defective vascular system, which means your blood vessels might be born with some defects. Either they are too fragile and therefore you bleed easily. Or number two, you could have issues with your platelets. It could be quantitative or qualitative defects of the platelets. So quantitative means you have a low count of the platelets, which is known as thrombocytopenia. While with the qualitative issue, it means your platelets are not functioning well. So these are called thrombopathy. And in the third case, you could have deficiency or dysfunction of blood clotting factors. Remember, you have at least 12 blood clotting factors. So when they are not working well, then you have problem triggering blood clotting. So this is known as coagulopathy. And last but not least, when you need to stop blood from clotting, you will need the thrombotic factors. So thrombotic disorders refer to any alterations in your hemostasis that impairs your capacity to stop blood clot formation. And now I'll explain a little bit more on the platelets. So these are the symptoms of platelet disorders such as easy bruising, excessive bleeding, and the picture rush. So the picture rush is the pinpoint hemorrhages caused by the leakage of blood from the capillaries. While this type of blood clotting is called the thrombotic thrombocytopenic purpura, and it's caused by a low platelet count. Well, you don't have to go through all these details, just have to know that it is a type of platelet disorders. And next, we'll look at several examples of coagulopathies. So showing here, you have a list of inherited coagulopathies, which is caused by some specific blood clotting factors, such as von Willebrand's disease. So apparently, in this disease, you have the lack of the von Willebrand factor. Remember, this is the factor that is required in the platelet plaque formation. So with this disease, you often lead to excessive gum bleeding. And for hemophilia A, it is associated with the lack of factor number 8, and it's an X-linked recessive disorder. And for hemophilia B, it is associated with factor number 9, which is very rare. It is also known as the Christmas disease. after the name of the patient who was first diagnosed with this disease. And both hemophilia A and B will cause excessive bleeding when the individuals are injured. Interestingly, hemophilia is also known as the royal disease. That's because it was once very rampant in the royal families of the Great Britain, and the culprit was Queen Victoria. She was probably a carrier of the X-linked recessive gene for hemophilia B. So for information, these black brackets denote carriers, while the red brackets denote manifestation of hemophilia. So from Queen Victoria, she passed the mutated genes to her offspring, Princess Alice, Prince Leopold, and Princess Beatrice. So from Princess Alice, the disease was spread to the Russian royal family, while Prince Leopold was still in Great Britain because a prince will not be married to other countries, while from Princess Beatrice, hemophilia was spread to Spain and Germany. So Battenberg is in Germany. So you could see how this mutated gene was passed down from one generation to another. But here's one thing that I want you to take notice. Do you see that all princes were affected by the disease, while all other princes, they were not affected? Why is it so? Well, that's because hemophilia is an X-linked recessive gene, which means for male we have XY chromosome. If the X chromosome is affected, there is no backup. But for female you have XX chromosome. So even one is affected, another X chromosome is there to produce the normal protein. Okay, so far we have looked at the inherited disorders of hemostasis, and now we'll look at the acquired disorders of hemostasis. So you can acquire hemostatic disorders if you have hepatic disease, which is problems with your liver because it is the organ by which blood clotting factors are being produced, or when you have deficiency in vitamin K because it is required in maturing some of the clotting factors, or in the case of renal disease because that can actually reduce your platelet count. So they have to go for the details. And sometimes we could have the drug-induced disorders. For example, when we're taking anticoagulants such as warfarin and heparin, we want our blood flow to be smooth and without unwanted clotting. So normally your old parents or your grandparents, they will take these drugs when they have a high risk of getting heart attack or high blood pressure. But sometimes certain drugs like aspirin, antibiotics, and barbiturates can affect the action of these anticoagulants by promoting serious bleeding. So these are the two classes of blood thinners to treat people with a tendency of getting stroke. The first one is anticoagulants such as warfarin and heparin, and they slow down your process of making blood clot by inhibiting the action of vitamin K. Why is it vitamin K? Because as mentioned, vitamin K is required in the synthesis of many blood clotting factors. While a second type of anticoagulants is antiplatelet drugs such as aspirin. So aspirin is not just for pain relief because it can also prevent your platelets from clumping together to form a clot. But you should never take aspirin with warfarin. What will happen if you do so? Well, you will get serious bleeding. And we have come to the end of this lecture. Please pause the video for a while to fill up the answers. Okay, the first one. An injury to a blood vessel initiates the process of what? Hemostasis, which is blood clotting. So blood clotting involves three steps. Number one is vasoconstriction or vascular spasm that constricts the flow of blood. Number two, you have the formation of a platelet plug to seal the opening temporarily. And number three, you have blood coagulation that enables the repair of the vessel to be done. So the synthesis of the fibrin in your blood clots involve either an intrinsic pathway or an extrinsic pathway, in which both cases will lead to the common pathway.